Welcome back. This is Gateway 101. In today's video, we're going to be talking about asthma. There are some people who are asthmatic, so we're going to be talking about uh, what is it? What is asthma? We're also going to be looking about some simple home remedy to help elevate asthma. We're also going to be looking about what trigger it, and we're also going to be looking at some preventive measure. So without wasting much time, without wasting much time, let's dive into it. Do not forget that whatever we are doing here does not constitute diagnosis or treatment. All we do at Gateway 101 is to create healthcare awareness. We also create some preventive tips and give you some simple home remedy to help alleviate illnesses. This is Gateway 101. Thank you for watching. So let's go. So asthma is a chronic long-term lung condition that make it harder to breathe because the airway in your lung become inflamed, that is swollen. Where something is inflamed, it's swollen. Because the airway in your lung become narrowed. Because the airway in your lung become filled with extra mucus. The airway in your lung becomes sensitive to triggers. So instead of air flowing smoothly in and out, the breathing tube tighten up, causing breathing problem. In asthma is a chronic long-term lung condition. It's a chronic long-term lungs condition that make it harder to breathe because the airway in your lung become inflamed. In other words, it is you find it difficult to breathe because the airway swollen. You find it difficult to breathe because the airway in your lung become narrowed. This will happen in asthmatic condition. So the airway in your lungs become filled with extra mucus. Please kindly subscribe to Gateway 101. The good Lord will bless you. Thank you. Thank you for subscribing. Thank you. So for inside of the air flowing smoothly in and out, the breathing tube tighten up, causing breathing problem. That's what happened in asthma. So please do not forget to subscribe. Thank you, Gateway 101. Subscribe. So what happened during asthma attack? You often hear people saying this social person had asthma attack. So what really happened when you have asthma attack? When asthma flared up, the airway reacts strongly to something. Something must have triggered. Okay, the something must have triggered it. So when that thing trigger asthma, so when asthma flared up, the airway reacts strongly to the trigger, to something that's triggered it. So leading to a tightening of the airway muscle. So something triggered and there's a reaction. So this lead to a tightening of the airway muscles, swelling inside the airway, or more mucus production, because there's something that trigger all this in asthmatic patients. Please do not forget subscribe and like. Okay, so this make breathing feel difficult because the airway has already been tightened and narrowed, and it's also become inflamed when there's a trigger. I would say this person had asthma attack. Asthma attack. There's a trigger factor. So when that and when it is triggered, guess what? There will be a reaction. So consequently, the airway would tighten up, therefore making it difficult for breathing. Okay, so this like trying to try to breathe through a straw. So tighten up. So what are the common symptoms of asthma? People with asthma may experience wheezing. When you go close to somebody with asthma, you hear this wheezy sound. You hear that wheezy sound. Is symptoms, it's a common symptom of asthma. So when somebody have that with us, oh, this cat has an asthma, you need to take a breathing treatment. So a whistle sound when breathing, that's one of the common symptoms of asthma. Then shortness of breath because the airway has not tightened and inflamed, so there will be a shortness of breath. Please kindly subscribe, very important, kindly subscribe, okay? Subscribe to get 101. So there will be a shortness of breath. There will be chest tightness and or pressure in the chest when there's asthma attack. These are some of the common symptoms. So the person will be coughing, especially at night or early morning. The person will be coughing. Okay, symptoms can be mild or severe, and they may come and go during asthma. So, what are the common trigger? What common asthma trigger? What trigger asthma? What are the common things that trigger asthma? Asthma symptoms can worsen due to dust, pollen, mold, pet. Okay, some people may be allergic to pollen. So, dust, mold, pet, all these things can trigger asthmatic. Okay, cold air or weather change. Yeah, during frequent weather change. Suddenly the temperature become cold and suddenly become high. Temperature fluctuating. That's why asthmatic patients, they are encouraged to set their temperature at home in a particular degree so that they don't, because they can hardly tolerate fluctuating temperature. Okay, so cold air, we said that before, or weather change can trigger asthma. Exercises, yeah, mostly vigorous exercise can also trigger the asthma. Smoke or strong smell, especially smoke, secondhand smoking too, or strong smell. There are some people they can't tolerate perfumes. They are allergic to everything. Perfume, smoke, burnt smell, anything smoke trigger the asthma. Okay. Respiratory infection, cold, flu, common cold, flu can also trigger asthmatic patient symptoms. So it can trigger asthma. Okay. So stress or strong emotions, yeah, stress can also trigger asthma. Yeah, if you have stress, it can also trigger asthma. Okay. Is asthma dangerous? Asthma is usually manageable. It is what? It is usually manageable. But severe attack can be a life-threatening if untreated. With proper treatment, most people live normal, active life. Okay? How is asthma treated? Treatment often include quick relief inhaler for sudden symptoms. Is here. So you see people with asthmatic patients carrying a inhaler with them wherever they go. So they carry inhaler. So because they quickly use that to get relief when they are when they have attack. Okay, Controller medication, daily medicine to prevent attack. Yeah, they take they put them on certain medications. So daily that help prevent attack. Avoid triggered when possible. If you know what trigger your asthma, avoid it. Mostly if you know that secondhand smoking or smoking trigger uh, your asthma, avoid it. If you know that perfume trigger your asthma, avoid it. So whatever is triggering your asthma, avoid it. Okay. So let's go through this again for the sake of you who are just joining, okay? Do not forget to subscribe. This is very important. Subscribe to Get 101. But for the sake of you who are just joining, let's recap. Let's run through this again so that you can better understand what we are talking about here. We are saying that asthma is a chronic long-term lung condition that make it harder to breathe because the airway in your lung become inflamed. The airway in your lung become narrowed. The airway in your lung become filled with extra mucus, and the airway in your lung become sensitive to triggers factors. Also said that instead of air flowing smoothly in and out, the breathing tube tighten up, causing breathing problems. Okay. Also said that what happened during an asthma attack. We said that when asthma flares up, the airway reacts strongly to something, a trigger, leading to tightening of the airway muscle. Also, swelling inside the airway, more mucus production. So this make breathing feel difficult, like trying to breathe through straw. It's like you try to breathe through straw. I would say that common symptom of asthma will be people with asthma may experience wheezing or whistling sound when they breathe. That kind of whistle sound, when they breathe during breathing. So, symptom of asthma attack symptom of asthma also be shortness of breath. You find it will be gagging for air, some hyperventilating, okay, struggling to breathe. So you will feel chest tightening and pressure. So cough, especially at night or early morning. I would say that symptoms can be mild or severe and they will come and go. Do not forget to subscribe. So we'll say that the common asthma trigger will be asthma symptom can worsen due to dust mite, polio, mold, and pet. It depends on what trigger your asthma. Also said that cold air, weather change can also trigger it. Also said that vigorous exercise can also trigger asthma. Smoke or strong smell, perfume, cigarette smoking can also trigger asthma. Respiratory infections such as common cold or flu can also trigger it. Also, stress or strong emotions can also trigger asthma. So is asthma dangerous? Yes, asthma is usually manageable, but severe attack can be life-threatening if untreated. But with proper treatment, most people live normal, active life. So how is asthma treated? We say treatment often include quick relief inhaler for sudden symptoms, controller medication, daily medicine to prevent attack, avoid triggers when possible. Okay, so let us look at some simple home remedy. Okay, some simple home remedy for asthmatic patient. Yes, simple home remedy to help alleviate asthmatic symptoms. So asthma can be scary and uncomfortable, so it makes sense to look for simple things you can do at home. Just a quick reality check. Though asthma cannot be cured with home remedy, and inhaler medication treatment are still the safest call treatment, especially during attack. But do not forget what we'll be saying here. We are saying that whatever we are saying here does not constitute diagnosis or treatment. Okay, so we are only creating healthcare awareness. That's what we do. That's all we do in Gateway 101. We create healthcare awareness. Okay, so we'll give you a Hippo's home remedy to help you. Okay, so it might not. This might not constitute treatment or cure. Okay, so the best treatment will also be your inhaler and medication treatment. So are still the best, safest core treatment for asthmatic patients, especially during attack. Home remedies can help support breathing and reduce trigger, but they should not replace prescribed medicine. Okay, so here are some simple, safe home remedies that can help. Simple home remedy to help asthmatic patient symptoms will be steam inhalation from congestion triggered asthma. If your asthma is triggered by congestion, you need to steam. You need steam inhalation. Warm steam up, help loosen mucus and open airway a bit. To sit in a warm shower or breathe steam from a bowl of hot water. Do not use if steam worsens your breathing. Okay? Always be careful to avoid burns. Warm fluid. Drinking warm liquid can smoothen airway and reduce irritation. Okay? Good option will be warm water, herbal tea such as ginger or turmeric tea, warm soup or broth. Okay, so ginger tea. Ginger has a natural anti-inflammatory effect and may help relax its airway muscle. How? Boil fresh ginger sliced in the water for 5 to 10 minutes. Drink 1 to 2 cups daily. This will help with inflammation. Okay. Turmeric milk, golden milk. Turmeric contains curcumin, which may help reduce inflammation also. So mix half teaspoon of turmeric, warm milk or plant milk, or add a little bit of honey. Avoid if you have a gallbladder issue or take blood thinner. Okay, so honey for cough and throat irritation. Honey help for cough and throat irritation. Honey can calm coughing, especially at night. So 1 teaspoon in warm water or tea. Not for children under 1 year old. Remember, children under 1 year old cannot take honey. It's no. Okay, children under 1 year old cannot take honey because it can be really dangerous. So don't give it to children under 1 year old. So breathing exercise, this can improve control. This can improve control over shortness of breath. Okay, pause lip breathing. Inhale nose, exhale slowly through lip. So diaphragmatic breathing, belly breathing. That's some of the simple exercise you can do to enhance breathing. Okay, practice daily for best result. Avoid common trigger at home. This is one of the biggest home treatment. Avoid common triggered at home. So in other words, if you know that your asthma is being triggered by smoke, avoid it. If you know that your asthma is being triggered by perfume, avoid it. If you know that your asthma is being triggered by cold weather or cold drink, avoid it. So this is one of the biggest home treatment. Avoid triggered. Reduce exposure to dust and bite. Wash bedding weekly. Smoke. Never stay around cigarette or incense if you know this trigger your asthma. Strong perfume or sprays, you can avoid them. Pet. Keep pet out of bedroom if you know you're sensitive to pet. Mold. Fix damp area quickly. Okay, use a humidifier if air is dry. These are some simple home remedy. Make sure you have a humidifier at home if you're an asthmatic patient, and use it if you feel that the room air is dry, because dry air can worsen asthma. Okay, keep humidifier around 30 to 50%. Okay, too much humidifier can cause mold, so don't overdo it. Clean indoor air Helpful tips. So open windows when air quality is good. Help HEPA air filter if possible. Vacuum regularly, preferably with a HEPA vacuum. Okay, so stay hydrated. Hydration keep mucus thinner and easy to clear. Aim for plenty of water daily. When asthma is an emergency, go to urgent care or ERO immediately if you are struggling to speak full sentence. Okay, this is an emergency. Lip or face look bluish. Seek a medical help immediately. Okay. Okay. So wheezing is severe or worsen. If you are wheezing and it's becoming severe, it's not getting better, you need to seek medical help ASAP. So rescue inhaler is not help. If rescue inhaler is not helping, then you need to go to urgent care. Breathing feel very tight or fast. You need to seek medical help. Okay, so let's talk about some preventive tips. Let's see how we prevent asthma. Let's get on some preventive tips. Okay, asthma can feel unpreventable, but the good news is a lot of asthma flare-up are preventable. Like I've said, if you know what triggers it, the best home remedy for it is to avoid it. Okay, with the right habit and trigger control, asthma can be controlled. It can be prevented. It can be prevented too. Okay, so it is preventable. That's the good news, and it's also avoid. You can actually avoid it. Once you avoid triggering uh, things, whatever trigger your asthma. If you can avoid it, then your asthma will become controllable or preventable. Okay, asthma itself cannot always be completely prevented, especially if it is genetic. But asthma attack and worsening symptoms absolutely can be reduced. Okay, here are the best way to prevent asthma flare up, to prevent asthma attack. Avoid your traps. Avoid your traps. In other words, avoid your triggers. Whatever trigger your asthma, avoid it. Okay, asthma symptoms usually start when something irritates the airway. So common trigger will include dust. We said that before. Bedding, carpet, smoke, cigarette, firewood, vaping. So strong smell, perfume, cleaning sprays. All this can trigger asthma. Okay, because don't forget that asthma is triggered when the airway is irritated. Okay, cold can also irritate the airway. Spicy food can also irritate the airway. So these are triggering factors. Pollen and mold can trigger asthma. Pet, air pollution, respiratory infections such as common cold and flu, vigorous exercise in some people. So the tip here is, the key takeaway here is keep track of what trigger your cough or wheezing. Keep indoor air clean. Your home environment matters a lot. Vacuum weekly. HEPA filter if possible. Wash bed sheet in hot water weekly. Use dust-proof pillow and mattresses cover. Fix leak quickly to prevent mold. Avoid indoor smoking completely because it will trigger your asthma. Okay? Stay away from smoke. Smoke is one of the strongest asthma irritator. One of the biggest trigger of asthma is smoke, cigarette smoking. So secondhand smoking too can also trigger it. Vaping can trigger it. Incense or burning candle can also trigger asthma. Okay, if you live with someone who smoke, ask them to smoke outdoor. Okay, because smoke is one of the biggest trigger of asthma. Okay, so prevent respiratory infection. Cold and fluid are big asthma triggers. So prevent respiratory infection. Protect yourself by washing hands often. Avoid close contact with sick people. Getting a yearly flu shot. Staying up to date on your pneumonia vaccine if advised. Okay. Take medication exactly as prescribed. If someone has asthma, the best prevention is daily control medicine if prescribed. Controller inhaler reduces inflammation long term. Rescue inhaler treats sudden symptoms. So skipping controller inhaler is a common reason asthma worsens. Exercise. Best bet smartly. Regular activity improve lung health. If exercise trigger asthma, warm up slowly. Use the inhaler before workout if advised. Avoid cold air. Wear masks. Maintain a healthy weight. Extra weight can worsen asthma symptoms by putting pressure on the lungs. So balanced diet plus regular movement can help a lot. Okay. So manage stress. Stress and anxiety can trigger asthma tightly. Helpful tip would be help breathing exercise, yoga or medication, good sleep routine, control allergies. Many asthma causes many asthma cases are allergy related. So if you have allergic asthma, treat hay fever early. Consider allergic testing. Use air filter if pollen is a problem. Have asthma action plan. If you or someone you know has asthma, a doctor can provide a plan that explains daily medication, early warning sign, what to do during asthma, when to seek medical care. This prevents serious attack. Seek urgent help if someone has severe trouble breathing, start gagging for air or wheezing seriously, and still wheezing after rescue inhaler or breathing treatment. Situation getting worse, seek medical help immediately. Or somebody telling or somebody lip turning blue or face turning blue, seek medical help immediately. Rescue inhaler not working, you seek medical help immediately. Difficulty speaking due to breathlessness, seek medical help immediately. That's an emergency. Okay? So without wasting much of your time, we are saying that if you have difficulty breathing, please seek medical help. Because if your rescue inhaler is not working, seek medical help immediately. If they give you your NAP treatment, they give you a breathing treatment, and it's still not helping, you need to seek medical help immediately. Or you begin to feel tightness in your chest, and you are still wheezing, you know you need medical help. Please seek medical help immediately. Do not forget that in Gateway 101, whatever we are saying here does not constitute diagnosis or cure. Okay, so that's why all we do is to create healthcare awareness. That's exactly what we're doing. We create healthcare awareness. We educate the public on common symptoms to look for. If you're experiencing these symptoms, then you need a medical help. If you're experiencing these medical symptoms, let's see if our home remedy can help. But if it doesn't help, the best option is going to be prescription medication. So this is Gateway 101. So I thank you all for tuning in for today's broadcast. We're still going to come back again to air late in the night because of those of you who could not join because of one reason or the other. Once again, happy Valentine. And thank you for staying with us. And for those of you who subscribe, remain blessed. Good luck on you to bless your family. Thank you. Once again, this is Gateway 101. Thank you for watching. Bye for now.